Welcome to CareSmart's 360 On Air, a home care podcast. I'm Mike Palladino, an account executive here at CareSmart's 360. Value-based payments shift the focus in home care from simply doing things to doing them well. Unlike traditional fee-for-service, where caregivers get paid per visit, value-based models reward agencies for positive care outcomes. It can include things like fewer hospital readmissions, better pain management, or increased care recipient satisfaction. This financial incentive creates a system where quality care is good business. Agencies invest in better training, communication, and care coordination to achieve these results. It encourages preventative measures to keep the elderly healthy, reducing overall costs. Seniors benefit from a more holistic approach to their care, focused on their well-being and not just completing tasks. Thus, value-based payments offer a promising approach to improve quality in home care. Today, we have Fady Sahhar on the panel, president of XtraGlobex, a consulting firm that provides strategy, analytics, and communication services to organizations specializing in healthcare, community-based and professional organizations serving Medicare and Medicaid populations, and also long-term care services and support. Welcome to the podcast, Fady.
Hi, it's good to be here.
Yeah, we're happy to have you on board and learn about the expertise you can share with regard to the value-based payment solution system. So with that said, Fady, I do have a list of questions for you, and I think it's best if we just dive right in. So
Go for it.
the first question I wanted to ask you is, can you define quality in the context of value-based payments for home care?
So quality is defined in a variety of terms. Some of it can be soft processes that organizations can implement, like monitoring their caregivers to show up on time, to serve the full shift, to report at the end of a shift if a changing condition has occurred. And while that may seem like a very simple everyday activity, the fact that an agency monitors that, records it, and takes action on it can be a very strong indicator of quality. Other forms of quality, again, can be simple processes that the organization has in place in terms of when a supervising quality manager or nurse checks in, the kind of reporting and measures that they have from their caregivers. But we also find that quality in many terms, as you get into value-based payment, relates to managing the cost of care. So we want to make sure that the agencies are taking actions that directly bring about a healthier consumer that we're serving. I'd like to believe that most of the people we serve are not sick. They just happen to be old or have a disability. So we don't want to treat them as sick people. And just like we do with everyday individuals, people who are not receiving these services, we want to be able to help them avoid higher levels of care and therefore higher costs.
Yeah, and I think that's such an amazing point you make, right? Because I think it's also synonymous with quality of care increases that value-based payment system, whereas the people that are happier with the care they're receiving are willing to pay a bit more for it in certain contexts, right? Because I think you put it beautifully. We are needing to treat people, not as if they're sick or they're incapable, rather, right? I think if you empower them with those quality services, the care outcomes are more likely to be positive, and the whole value-based system is going to flourish, right? Because everyone's kind of reaping the benefits of exactly what your intentions are.
Absolutely.
So yeah, I think that's a beautiful way to put it. And it's certainly, as we go through this, I think a lot of the commonalities we're going to see is really the quality, but also the communication that you can really instill amongst the care providers and the care recipients. And I think as long as everyone's on the same page from the top down, from the agency to manage where they are and making sure they're on premise and providing good care, the notes that are being taken about the recipient and also being provided back to the agency is going to help everybody from the quality perspective to really ensure that we're giving the best possible care to that individual to ensure the outcome is a more positive one, or at least more likely to be a positive one.
Absolutely. And it's interesting as you're talking. One of the things that is important for a payer or an MCO, or if in a private pay environment even, is that you need consistency. You need to make sure that as an agency you're providing consistently quality services. It's not good enough to make sure that on Friday when the supervisor is coming to check on you, that the house is impeccable and
Hmm.
the consumer is well dressed. So it's really valuable for us to know that all of our caregivers are going to perform in a similar manner. And no matter when we check, we're going to find the same kind of results.
Yeah, beautifully said. And I think that model is the one that I would want if I was getting care for my loved one. And funny enough, we do have an elderly grandfather. He's 95 years old. As you mentioned, he's just elderly. It's not like he's sick or anything like that, but he just needs assistance and he needs someone to really just ensure his daily activities, whether it's cleaning the house, cleaning the bathroom, bathing. He can do all these things on his own, but having somebody to help is just ensuring that his end of life is more positive, right? And we love the communication that the agency we provide or that provides us with services gives us, and everyone's happy with it. There's no complaints. And on that same topic, we're willing to pay a premium because we know that our loved one is receiving excellent care, right? Awesome. So the next question, that's a great segue, is how can caregivers be best equipped to deliver the quality care needed under a value-based payment system?
Uh, I believe that what gets measured gets done, right? So if we train our caregivers to report on and evaluate the work they're doing themselves, they're going to do a better job at it.
Hmm.
And so the number one factor in getting the results from value-based payments is to make sure that your caregivers are appropriately trained for the people that they're serving. And it comes sometimes in very interesting ways. At the very basic level, you want to make sure that the person is being treated with respect and dignity, that they're not being forced to do things that they don't want to be doing. But from a value-based perspective, now keep in mind that many of our healthcare providers, whether home care or home health providers, have measures that they come from a CAP survey or from some kind of an MCO who's telling them what is important to them. So
Hmm.
knowing what those measures are and then training to them is very important. And recognizing, I was recently talking with a group of providers, and I said, we don't hesitate to train our young people to be good batters when we want to teach them to be, or good pitchers when we're on a baseball field.
Yeah.
Yet we just let a caregiver walk into the house and sometimes just do what they think is best. We taking appropriate care to make sure that they know what's what's the best way to treat a consumer when they're in their home is a first and step to it, but also letting them know what the rewards of quality services are
Mm.
and sharing it with them. I find simple things like recognition of the caregivers on a frequent basis, peer recognition, as well as additional pay is always a good way to incentivize these caregivers. But as an agency, you have to be able to respond to the market where you work. You can't just say a same agency in New York and in Miami are not going to perform in the same way, because while they're all reporting to some big MCO somewhere, they may have different standards of expectation from what the DOH in New York wants versus what
Yeah.
DOH in Florida wants.
Yeah, I think you've said it again beautifully, and I think it's really just setting the standard of care. And the way that I've always perceived this, and I say this because my mom actually did run a marketing agency for about 30 years, always faced similar challenges with caregivers from a lot of different angles, right? Could be never
Mhm.
missing, never clocking in or clocking out on time, or documenting it, or missing notes, or that kind of thing, or not showing up and disappearing, right? There's always going to be, I think, inherent challenges, but I think the easiest way to solve solve for that is setting the standard of care from the top down. And that comes with a few different things, right? It comes with training. It comes with providing them the right documentation and support to do their jobs very well. And it also comes from communication, right? I think as long as you openly communicate to them, whether it's recognition, whether it's bonus pay, or just, giving them some sort of incentive to really care about the work that they're doing and not look at it as just a job, I think those are the real important factors that really can ensure that the caregiver matches the quality that the agency is looking to convey.
And to that point, before you jump to the next question, is that each of us sometimes will interpret what is excellent work. Sometimes as an agency, or you need to make clear that you explain to your caregiver what is excellent work and reward it accordingly.
Yeah, I couldn't agree more. And I think that's, again, it's kind of going back to the top-down approach where you have to lead by example. And I think it's just setting the gold standard of what care looks like. And the way that my mom kind of positioned it she's retired now, but in her day, it was, how would you want to be treated if you were in their position? Be empathetic. Are you going the extra mile to make sure you did that thing for them? Are you, just kind of glossing over the tasks and just marking them down? Or did you really take the time to lift everything and dust it? Maybe they maybe they have asthma, or maybe they have a sinus problem, they have difficulty breathing, they have COPD. You need to make sure things in their house are clean, right, or dusted so it doesn't impede them. And those things is really what my mom focused on, was try to put yourself in their shoes. And would you be satisfied with the care that you gave to them if they were giving it to you, right? And I think that's always resonated with me. It's almost like that golden rule, right? Do unto others as you would have them do to you, not to go down that path. But I do think that there's merit there, that you want to treat people as you want to be treated too.
Sure.
Yeah, awesome. So that again, all these questions kind of do segue into one another. So
Yeah.
the next one really focuses on challenges. So what potential challenges do you see with a value-based payment system in home care, and how do you address them?
So I earlier talked about consistency. Consistency comes from being able to measure and monitor and track and report and trend. So one of the things that I think one of the major challenges for an agency trying to enter a value-based contract is that they need to be able to validate that they are doing the things they say they're doing. And therefore they, in the early days of value-based payments, I used to say when I gave talks, go out and buy an abacus and learn to count. Learn to count whatever it is that you want to count. How many times did the people show up on time? How many people did they clock out on time? How many times did they get a 9 out of 10 rating? How long did you wait to process a new member, a new consumer into your agency? Just learning to count. So then the challenge is that value-based payments are outcome driven. And so we're looking for ways that the agency or the provider can demonstrate that they have completed certain action. And therefore those actions have resulted in the outcomes that we're looking for. It's not good enough for somebody's A1C score to be, still 7.0 forever, because that may have nothing to do with what the agency is doing. So the number one thing that I find is a challenge is for agencies to be able to gain that attribution, that ability to say, I did this, and therefore I deserve the credit for the outcome. And it comes in very simple ways. For example, I had in my early days in home care, we had an individual who was helping a person who was bedridden. And while she was getting that person out of bed every day, bathing them and all that, she did not report to the agency that there was a sore developing on this person's foot. It took about 35, 40 days later, a nurse was visiting and observes the sore. Now the person needs to be hospitalized.
Yeah.
That sore. So sometimes it's like, so the person showed up to work, did the work every day, but did not do the thing that could have prevented the hospital event or the
Yeah.
need to meet a doctor. So it's those kind of observation, tracking, and making sure that you're knowing what you're looking for. Medication compliance for many of our elderly people is a huge issue, and as a payer or as an agency, you want to be appropriately training people not to make your consumer take their medication, but to remind them appropriately, to make sure that they're eating the food that they need to consume while they're taking certain medication, etc. So that the
Yeah.
work you do literally results in the outcomes that you say you're delivering.
Yeah, that story resonates with me regarding the SOAR, right? Because that again kind of alludes to the fact of like, it's the top-down idea of you really want to set the gold standard of care. And we can easily go and just mark off the tasks and kind of go through the motions of care. But if that scenario, if we had properly documented it, even if we saw it, we just say, I was tidying this and I noticed there was a bit of a sore developing on the foot. Those notes are transferred to the care coordinator. That care coordinator can see them, maybe say, okay, we're going to monitor that on the next visit. If it gets worse, we're going to send the clinical team over to do maybe a head to toe assessment. If from there, maybe we can wrap it, clean it, sterilize it, and then it prevents a readmission or a hospital visit. But if those things don't get documented, or we feel lazy, or we just simply didn't care enough to do that, which unfortunately sometimes is the case, then it's like the domino effect. Everything gets worse and compounds. So it's really just going back to the quality of care, and preventing it is really a training effort and really a standard setting effort to really empower them to do the jobs well, but also recognize the jobs that are done well and incentivize them accordingly, like you said earlier.
But also keep in mind that it's just as important for the care coordinator who receives that note. Maybe the caregiver actually put in the notes that there
Yeah.
was a split, but that the caring and sufficient involvement to know that, yep, I need to go back and check on this again, or put something in my tickler file that in 3 days I need to go back and ask the caregiver whether this has changed. So
Yeah. Yeah, I think there's a lot. So I've done a lot of these podcasts and interviews, and I think there's a few synonymous topics that we always seem to get back to. And one of them is communication, effective communication. Did I know what I was supposed to do on my job? And if I did it right, when I communicated it to the next person in line, was it clear? No, did they accept that communication and then communicate it to their next line in the process, and so on? So having that clear and concise communication really goes a long way. And also it's acting upon those communications and knowing and understanding what's being said and what the outcomes possibly are, good or bad. So I think that's just a very common topic. No matter what we kind of land on, it's really just being an effective communicator and what's in front of you, understanding it and kind of thinking about the possible outcomes to that scenario. Because again, going back to that example you gave us, if we're for a home care agency, right? We want ultimately our clients to stay home, because if they're readmitted to a hospital, we potentially lose that client for a period of time, or maybe they're permanently in the hospital now and we've now lost a client. So there's also a business side of this that has a big impact if we're not kind of doing the steps required to ensure the care is adequate, or no, or and so on.
yeah, it's a very challenging environment, and making sure all the links in the chain are working.
Yeah.
Communication sometimes is also maligned because people will think that, well, I gave them a poster, or I gave them a refrigerator sticker, or
Yeah.
or I sent them a text, or any of that. So it's sometimes we have to make sure that the communication is being received
It's
as
the
well.
follow through of it too,
Yeah.
right? There's I like the way you put it. There's a lot of links in the chain, and um, there's a lot of things that can ultimately break that chain of communication if there's something that gets missed, right? So I think as you mentioned, it's a challenging industry. There's always going to be a caveat here or there, but it's really what are we doing to stay on top of it and just get better every day? Because again, our industry feels like it changes overnight. What's acceptable today or what system is the gold standard today might change tomorrow, or there might be a new state regulation, might be something else we got to follow now. So it's really just having that effective communication, but the follow through on it as well, just to make sure we are, meeting the standard.
Yep, absolutely.
Awesome. So we talked about some challenges. Let's now talk about some successes. So can you share any success stories of how value-based payments have, demonstrably improved care outcomes in your experience?
Yeah, it's really interesting. I work with clients across the country, and I've had the opportunity to find that the more successful situations are the ones where there's an involvement and a clear understanding of what it is. I'll give you an example. Working with an agency in the Philadelphia area recently, and they had a group of diabetic consumers that they were focused on. But these individuals lived at home, and they were prone to what I call the Saturday night boredom that led to somebody going to the emergency room. And so this particular agency identified what they called their frequent flyers, and they approached their payer and said, we're finding that these 12 individuals are going to the emergency room at least once or twice every month.
Wow.
And this is a big deal. And we'd like to see how we can help you avoid those costs. And so in the process, they provided some diabetes training for the consumer. They provided training for the caregivers, but they also did things to adjust the schedule so that they were doing some things on Friday and whenever they were working on Saturday, specifically targeted to identify what are the elements that were driving these individuals to go
Yeah.
emergency room. And then the easiest part of it was they set up a telehealth support. They said, if I'm not here and you feel the need to go to the emergency room, call this number. And they had
Hmm.
a nurse on the other end, and the nurse talked to them, said, what are you experiencing? What are the things that I can help you with? And there are times when the consumer needs to go to the hospital, no question. And we don't want the person to not go if they require the care. However, by providing an intervention in a way that anticipated the behavior in a constructive way, they were able to reduce that hospitalization rate very substantially. And they were rewarded very well for it. I mean, that's where shared savings and value-based payments can be an amazing reward for an agency.
Yeah.
All of a sudden, you're not getting 12 cents an hour, you're getting $4,000. So
Yeah.
no, it makes a big difference.
That
And
intervention is brilliant. I think, that's an amazing way to problem solve, but that also comes down to the data that you receive, right?
right,
And you can see the facts, and if you can just analyze them and understand what's the root cause, you can then start to put solutions in place, which at the end of it all, what does it do? Well, it increases the care outcomes because now there's less hospitalization, there's more trust gained, which just again, it's the domino effect. When you
yep,
build that trust, you build that kind of relationship, they're going to be more open and honest with you about what's ailing them, right? And B, you can provide better care. So it's a nice way to think about it. I've not seen an example like that, so I just learned something new, and I think that that's just a fantastic approach that more agencies can implement because
yeah.
really that telehealth idea, I hope agencies do that more. My mom's never did that, and I don't know why now thinking back on it, but
Well, it's
um,
it's emerging. It tends to be, an investment that you have
yeah,
to have a nurse on call available during the times when you usually don't have a nurse available in a traditional agency. So
yeah,
but there's some real innovative approaches that are taking place. Another agency that I was recently involved in, their payer wanted to make sure that their folks did four things every year: go to your PCP, go to your dentist, get your flu shot and get your COVID shot. And they basically reached out to their payer and said, these are HEDIS measures that you get star ratings for and you get paid better when you have better scores. We want to help you. And so they created a program where the caregiver was reminding the consumer, helping them set the appointment to go to their PCP, helping them go see their dentist.
Wow.
And then they paid them $25 for every time the consumer did that.
Wow.
And and it was great. It was like that was performance. They could demonstrate that what they did resulted in the four elements that truly improved this individual's health.
Yeah. And it almost seems obvious to do these kinds of things, but it allows you to kind of take a step back and think like, when you really incentivize the individual to follow that structured approach or the four elements of success, right? They earn more money, they
Yeah.
have a better client in terms of care outcomes, and they're likely to have a long-term relationship with that individual
Now
because
they care and understand a lot
exactly.
better what
Yeah.
makes this person tick. So
Yeah, that's such a great outlook on things, and honestly, I think a brilliant approach. So the last question that I wanted to ask you today is how are family members kept informed and also involved in the value-based care plan for their loved one?
well, it varies, right? Not some family members look at the caregiver who's coming into their home as respite, right?
Mm,
You're taking care of grandma, so I don't have to.
yeah,
Uh, and so some people don't want a lot of information. The good news is the vast majority of families want to be involved.
yeah,
And if they happen to be in the home with the individual receiving services, then you find that the interaction between the caregiver and the family member becomes a very important dimension
yeah,
of how the care is delivered because there's like permanent supervision, right?
yeah,
You know if grandma is not comfortable sitting in a robe that she wore for 3 days and so on. So you're as a family, so you can really provide that. And we haven't gotten to the point where family members can earn a part of what the value-based rewards are yet, because the only place where I've seen it work is with consumer-directed services,
right.
where you have the consumer employer model or the agency with choice model, where it's a co-employer model. In those situations, you find that the same kind of incentives that are being used with caregivers are being at least attempted with the family members. But family members are also doing when you have an elderly or disabled person in your home that you're providing these supports for, it's exhausting, and we need to recognize sometimes that part of our role as providers and as caregivers is to make sure that we're supporting them in the way that helps them be successful in the caring for their loved one.
Yeah. It's so true, and I actually have a lot of agencies now under my portfolio that are doing consumer-directed care, typically for Medicaid, right? Where states where the family member is the caregiver, they're now incentivizing and monetizing it. And I think it's just a great approach, but also it allows them to really be, involved in what's going on and do a kind of a better job at providing that care. And I
Mhm.
always like too when, the family, even if it's not consumer directed, when the family is really involved, like I like to think my family is quite involved in my grandfather's care. That communication, everyone's on the same page. If he has a bad day, we know about it. If he has a bad day, he refuses something, we can help him get on the same page as the care because we recognize it's important to him to take his medications and things like that, right? And I think that really just helps everyone feel more connected to the situation, but also have
Mhm.
the confidence in their own responsibilities in the care, and whether that's directly being the care provider or overseeing the care, authorizing what went on that day, just being involved. All of these things, especially when you talk the value-based approach, are critical to success, right? As long as everyone's aware of what's going on, it's going to make that situation much more fruitful for everybody.
Yes, I agree with you. And but it's also how do we create the environment where this engagement is also creating consistency, supporting the proper interventions without taking away the ability of the person receiving the care, the consumer, to give up their right to what they want. And
Yeah.
I go back, I'm a person in a wheelchair, and I've been an advocate all my life. And so I know that it's very important that the first and foremost that we take care of the individual's dignity, that we treat them with respect, and that they are able to participate in life to the extent they wish. And our job is to support them, not to tell them how to live. So,
Yeah. Yeah, exactly. Beautifully said. And those are the rules that I think everyone should try to live by, especially in home care. It's just supporting the individual in a way that allows them to live their life. And I think that's the most important thing.
yep.
All right. Well, Fady, this is great. Thank you so much for sharing those amazing insights. I'm sure the audience got all the deep insights they're looking for about value-based payments and how that can help improve quality in home care. To you, the wonderful audience, thanks again for tuning in. And until the next episode, this is Mike signing off. Thanks, Fady.
Thank you very much.